Good evening, everyone. Welcome to the Helpful Doctor Who Pause Wins podcast or live, depending on what platform you are watching. And today we are going to cover a bit about cancer and the holistic path and integration with sort of conventional approaches. And this is actually inspired by my own dog, Rowan, who you may hear in the background because he's just recently been diagnosed with laryngeal cancer. So I'm going to cover a little bit about our own story and also look at sort of, as I said, the world of sort of alternative and complementary therapies, because it is a bit of a minefield. So if you're new here, welcome. My name is Dr. Helene. I'm an emergency medicine doctor and also a certified animal aromatherapy specialist. And I love to help people with an integrative approach to their health and that of their dogs and cats and bunnies. So do hit the follow or the subscribe button and let me know in the comments what sort of things you want to learn about as well, because it helps me create more content. So Rowan was diagnosed just over 2 weeks ago with inoperable laryngeal cancer with lung metastases. So this actually came as a real shock because just a few months ago, there was no sign of cancer when he had a neck abscess. We do now suspect that they were linked, but it didn't show on the CT scan. He's also got chronic bronchitis, which is very likely that it was due to passive cannabis inhalation before he was rescued, and he was born in the house that he originally came from. So he's been subjected to that for a long time, even though he's been with me 10 years. It's, in his formative time. So a cancer diagnosis was always a possibility, but I wasn't expecting it to be this acute and this aggressive. A couple of weeks ago, Rowan's breathing became very wheezy. The day before, we'd been on the beach and he'd been going up and down sand dunes. He was a little bit breathless, and he'd been getting a bit more breathless over the sort of preceding couple of weeks, but I thought it was due to his bronchitis, and I was actually looking for another consultation with the respiratory vet. He'd had some courses of antibiotics and steroids, and anyway, he deteriorated. So he went into Vets Now, which is the most amazing vet hospital in Manchester. We are very, very blessed. And it was quite emotional, so obviously leaving him there on oxygen, and then he had a CT the next day, and the vet sort of said to me, "I've got some bad news for you." So immediately he said that, I thought, oh my God, he's died, because sadly that happened to my beautiful dog Evie, who died in May under anaesthetic just 2 weeks after I lost my elderly dog Maz. So it's been a really awful year. And then he sort of said Rowan had cancer. So I kind of felt relief. Even though obviously it was devastating, because at that moment in time I was fearing it was even worse. So it's obviously been a really difficult time, and I've written a blog about this, and I wrote the blog about 10 days ago, and I was sort of more optimistic. I was fairly optimistic. The vet had rung round quite a few centres, and because originally he said, there isn't any hope, but then he said there is some possibility of treatment, and I was getting a referral, and I'm obviously exploring every holistic option, obviously, and it's kind of changed, and I'm gonna go into what's happened over the last sort of week, really, because the cancer is a very aggressive cancer. So I get a lot of inquiries for help with cancer care, canine cancer care, and human, actually, from a sort of an integrative point of view. And I'm always glad to offer guidance. And so I think the first thing to appreciate is there is a lot of Facebook groups out there that offer advice, but the major problem is they don't address individual cases. And these groups are often run by anonymous individuals, and the protocols they suggest frequently lack any evidence. Sometimes they're based on alleged success with just one dog and then promoted as a cure. And one such example that I came, because I actually had this deep dive in with Evie a couple of years ago. She was diagnosed as with splenic mast cell cancer, and it wasn't. She had her spleen removed, and the oncologist said, I just don't think this is. It's just weird because it presents weirdly, but obviously she's got these lesions on her liver and her spleen, and the liver ones cleared up, but the spleen didn't. And so she had her spleen out, and then they found out it wasn't cancer. But I had this deep dive into cancer care. Anyway, one such group was sort of suggesting a protocol for cancer care was cream cheese and salmon oil. So there's no evidence of efficacy there. And, some of the advice there was genuinely poor. So just, on the subject of mast cells, they are very rich in heparin and histamine. And I once commented in the group that after someone suggested using turmeric, pointed out that it shouldn't be used in this type of cancer due to its anticoagulant effect. Turmeric has an anticoagulant effect, and you've got heparin, which is an anticoagulant, and then obviously that can be very dangerous. And my comment was flagged by multiple followers, and eventually the admin conceded, because I think it got flagged loads of times, and then the admin went, "Oh, actually, yes, she's right." And I was like, but had I not intervened, people would have been giving that dog turmeric, which, and then there were many other examples of that. And I ended up getting booted out from the group, which is fine. But, it was quite concerning what was actually going on in there with people, like ignoring vet advice and going down this route and there's a lot of other groups like that. I mean, just last week, I was in a group and someone had pain in their ear, and really bad, severe pain. And people were suggesting putting stuff in the ear. And I said, well, you shouldn't put stuff in the ear, because if it's a perforation, you're going to cause more damage. And someone then posted, "Oh, we'll have to agree to disagree." And I went to reply saying, well, I'm sorry, I don't agree, because I'm a doctor. And I'd already been blocked from commenting for 24 hours in the group. So, it's crazy, the fact that they don't want real proper advice. And I'm not, I'm very into natural options, but there also needs to be sense with it as well, and not, putting things like hydrogen peroxide in your ear when you may have an ear perforation is just dangerous. But anyway, the other side of this is the fact that you've got people who are lay people calling themselves names that it might imply that they're a doctor. I've come across people calling them functional oncology practitioners. And so you expect they're a doctor or something, but they're actually not. And they've had no medical training at all, or they've helped one person with cancer, and then they're like this so-called expert. And so the advice is really dodgy. So you do need to be really careful. Now, I am very into a balanced approach, and there are excellent natural options that can support you or your dog through cancer, and some may even change the disease trajectory. But whether it's natural or not, they can interfere with medication. And so you do need expert advice, and you do need to work with a practitioner. And, many of these options are very rich in antioxidants, which actually can interfere with chemotherapy or radiotherapy. And it's vital to allow conventional treatment to do its job. And you need to disclose all the therapies that you're using to your oncologist so that they can advise. And I've always found oncologists to be very open to other therapies because of the nature of cancer. It is inherently a disease with many different trajectories. And, it varies from person to person. There's so many different options in some cases, with surgery, chemo, immunotherapy, radiotherapy. And also it's such an unknown thing, where it's unlike, pneumonia or something, where it's very likely antibiotics will clear it up if we know what the culture is, or we can use empirical sort of options. But we don't have those same sort of guarantees with cancer. So just back to Rowan's journey. So vet at Vets Now was great. He spoke to several oncology departments, including Cambridge Vet School and the Vets Now oncology department. And he discovered that there was perhaps a possibility of therapy involving a particular drug called Palladia and radiotherapy. And this would be palliative treatment, so because it's inoperable. So in humans, they do laryngectomy, so they take the voice box out. And you've often seen people perhaps with a hole in their throat, and then they've got sort of an artificial voice box there. They don't tend to do that in dogs. It's very, very radical surgery, and it wouldn't, with his case as well, he's got lung metastases as well. But so that would be more curative. But palliative is sort of trying to, you're not getting rid of the cancer, but maybe actually you're reducing it, and you're extending life and comfort, and, extending quality of life. So I was writing this all in my blog, and I had, I felt that I still had many things to do, even though it was palliative. And the week that I wrote the blog, we would still experience many up and downs, but twice in the week he chased a squirrel. So I was like, oh my goodness. And I wouldn't normally allow that. No squirrels were hurt, but it showed me that actually he was doing really well. And then we've had a bit of a blip, and I'll sort of tell you about that really, because he was doing really well, and then he had 2 doses of the Palladia, and he dipped on the Friday afternoon. He had a vomit, and he didn't want his dinner, and then Saturday morning he didn't want his dinner, and so I toddled off to Pets at Home to try and get all manner of food, different cans of food, things that I would normally never feed him, but to see if I could tempt him. And he ate quite well on Saturday, and I just sort of gave him meals frequently of different options, and I was quite pleased Saturday night. And then on Sunday he just didn't want any food. I gave him some antiemetics, it didn't help. He was having painkillers and everything, and I didn't know. So there's a number of things. So Palladia is a tyrosine kinase inhibitor. It has actually been found to be beneficial in lots of different cases. It's primarily used for mast cell cancer, but it's been found effective in other cases. So it can cause nausea, it can cause sort of inappetite, it can cause vomiting and other GI disturbances such as bleeding and things like that. So I wasn't sure if the vomiting was, the one vomit he had was because of that. I wasn't sure if the inappetite was because of that. I wasn't sure if the fact he didn't want to eat was because of nausea. So I'm trying everything. I'm using my oils and everything. I'm diffusing oils that help with nausea. I'm diffusing oils that help with appetite stimulation, and not getting anywhere. And woke up Monday morning and we went straight off to the vets, to having heard back from Vets Now with some advice. Went straight off to the vets, and Rowan had an injection of an antiemetic, and he had a painkiller as well, because I was like, well, is it pain in his throat that's causing the problem? Because I'd been giving him meds in food, and then I'd had to try and get stuff down his throat. And, obviously that's not ideal because he wasn't taking food. I had to do that. So he had a little bit of an improvement on Monday night with some food, but not enough. Tuesday, back at the vets in the morning, and he had an injection that's like an anabolic steroid. And then he perked up after that as well. So I was quite pleased, and he did eat. I went and got some chicken and cooked chicken and sausages, and he ate, and so I was quite pleased. And then Wednesday, he just really wasn't eating well again Wednesday morning. And Wednesday, we actually had an appointment with the oncologist. So it was a telephone consultation. So when the fabulous vet, James from Vets Now, was speaking to all these oncology departments, they were all recommending this centre called Southfields down in Basildon. And this guy called James Elliott, who is like, I think he's pretty much like the best in Europe. And he's worked in America, and people send their real tough cases, the cases that they're like, we can't help you, but this guy might be able to help you. And it's like, I think it's like this 19 million pound centre that's been built down in Basildon. It's really impressive. And I would really go and Google it, because it's really impressive looking at it all. So I had this consultation with him, and, I had to tell him about sort of Rowan, and, he dipped and everything. And so this guy, with his extensive cancer experience, has only ever seen 3 laryngeal cancers in dogs, because they are so rare. And the big problem with laryngeal cancer is where it is. And so radiotherapy has potential pitfalls for him. And, he said he was absolutely lovely. And I, even though the news wasn't good, I feel that I've explored all the options, because he felt, in a dog that hasn't got a great quality of life, which is what it was at that particular time, as opposed to the week before, he felt that the risks outweighed any benefits, because you can't give a big dose of radiotherapy because of where the tumor is, because of the risk of complications in the surrounding tissues. So complications like edema, so not being able to take out the tube that you use for intubation, so he wouldn't be able to get off a ventilator, those sort of things. And then you've got these repeat appointments, which isn't in itself a problem, but he's also quite fearful of the vets. But also the fact that you've got the anaesthetic risk, and bearing in mind, I've already had a dog die anaesthetic. But also the dose of radiotherapy, like I said, is mild. So it's not necessarily going to have the effect that you want it to have. And so you have to balance that all up. So the plan is to reassess on Monday. But he suggested some other options as well. So he thought, because I felt that Rowan's breathing had got worse, I've been nebulizing different things. He finished a course of antibiotics about 7 days ago. So he thought it was worth trying another course of antibiotics because it's likely he may have had another aspiration pneumonia. He mentioned a drug called Entice, which was specifically developed for dogs who need an appetite stimulant. So this is Entyce. So Rowan that day had metazapine, which is a drug that has as a side effect an appetite stimulant, the same as the anabolic steroid he had, but this is actually designed as an appetite stimulant. So he suggested that, and then, like I said, the antibiotics. So we had a lovely consultation, absolutely fantastic guy. So I trotted off to Vets Now for this Entice, because not everywhere has it. My vet didn't have it in stock. Vets Now had it, and it's a really expensive drug. So this isn't the fault of the vet. It is just really expensive. I think for one bottle it's like over £100, and it's just a 30ml bottle, but he has a sort of portion of that. And that is definitely helping with his appetite. And I'm going to cover some appetite stuff in a minute. But I don't know. I also have been giving him he's having more regular pain relief, and he's also having some Ondansetron melts. So this is an antiemetic that's a melt. It's a film. And I've got it on a private prescription, and I'm not kidding. 10 of these little films cost me £42. But again, it means that I haven't got to shove anything down his throat. I just put it under his tongue or his lip, and it dissolves. And so part of the problem with him as well is because he won't take food. I'm having to put these meds down his throat, which isn't ideal. So, I don't want any of the force-free community coming at me, because I don't do stuff in food because he's not taking food. And I actually don't want to take the risk that anything I put in food is going to put him off food, because I'm struggling to get him to eat. So, this is all the stuff I'm having to do. But he is starting to eat, and I am feeding a load of variety of different foods. So I'm going to come into that in a little bit, but I don't know whether it's because of nausea that and I'm managing that he's eating, or because of pain and I'm managing that, and then he eats all the appetite stimulant, because it seems to be that I think it's might be a combination of all three, or it's just the cancer, but he just needs appetite stimulants. I've just recently got a delivery from Door West Herbs, which is, I think it's called malted kelp tablets, which the reviews were amazing for these tablets to get dogs to eat. My big problem with them is I've still got to put them down his throat, and they're actually going to be harder than the Entice because of the tablet size. So it's all a balance. It's really difficult. I need to keep him calm. So I'm using my oils to keep him calm, because when he gets agitated, his breathing goes up. And so I'm using oils diffused for calmness. I'm also using oils internally, and I just rub some on his gums to support calmness. And he's also having oils nebulized for his breathing, as well as rubbed over his throat as well, which will help with pain relief, as well as potentially supportive against cancer. But let's just go back onto the little cancer stuff now. So I sometimes encounter people whose dogs are in the very late stages, with vets advising euthanasia as well, that come to me to ask for help. And, again, there's lots that you can do with keeping your dog comfortable. And I don't know what stage we're at with Rowan at the moment. I actually thought these last 2 days might be the end. And I planned the walks out, which we've done. But he has improved somewhat. So it's literally an every hour, sort of every day kind of scenario. But I do believe that people should follow their vet's advice, because and it's very difficult, because there are a lot of people that will be out there promising stuff. And I've had people come to me saying, well, and I've said, look, I'm really sorry, I don't think there's anything else I can offer you, but I can help you keep your dog comfortable. And they're like, oh, well, I've spoken to someone who suggested this protocol, and I'm going to try it. It's not cheap, but and they spend a lot of money on it. And then, I follow them up to see how they're doing, and they've had to have their dog put to sleep within a couple of weeks. And it's so sad, because it's, one of the things I'm really worried about with Rowan is that I want to make sure he goes on a good day. And there is always this, what is a good, when is the good day? I don't want to give up on him too early, but I also don't want to not go on a good day. So it's this constant balance. But you do need to be careful of, what people say. Now, of course, I do charge for consultations because they do involve a lot of work, but I will always be honest with people. And, I won't, and I have lost clients because I've said, I really don't think there's anything, that we can do, but except keep them comfortable. Or in one case, it was like, I think the vet had given this dog, like, you need to have this dog put to sleep immediately. And I said, I don't think I can help you. And then they went and spoke to someone who promised them, and it was just sad, and it's not fair on the owner or the dog, in situations like that. And I recently had a consultation from a human perspective that was very challenging, and I had some great options for their primary cancer, but the metastases presented other problems. And this is the thing with some natural options, such as essential oil, they can interfere with current medications. And, again, this is why you need that expert guidance, either on its own, or if you're going to use them on your own, or integrative, in an integrative way. And, I always like to suggest throwing everything you can, but you also need to make sure it's not affecting anything, and not just the medications, but in some cases, because of the complications from the original cancer, there are some oils that might not be suitable. So, either, if it's a dog consult, a holistic vet, or a practitioner like myself with actual training, which I'm a doctor and a certified animal aromatherapist and an essential oils expert. I've been trained and endorsed by a vet. And I'm always happy to share information, and my natural recommendations with oncology as well. And, the oncologist I spoke to, both times, actually, the one for Evie and the guy down at Southfield, James Elliott, they were very open to what I was doing, and I was able to have a very nice discussion with them about different options to support Rowan, and originally to support Evie. And obviously I can review blood results and things. So let's just look at some practical tips for your dogs. And again, for you as well, this is mainly aimed at dogs, but there's tips in here that I think will be good for humans. But for dogs and you, minimally processed diet. Okay. And you want to do this to avoid stressing your dog's immune system. Now, for humans, a whole food, plant-based diet is going to be the best option for you. For your dogs, it needs to be minimally processed, and getting them off kibble is crucial. And the Keto Pet Sanctuary did some really interesting work using a keto diet to help shelter dogs with cancer. Now, the studies showed really good results, but it's important to remember this was done under very controlled conditions with specific exercise regimes. So it may not be easy to replicate in the real world, but it still highlights promising outcomes. Now, full disclosure, I've got all this diet designed, and for several days, Rowan was eating this diet with gusto. And then when he stopped going off his food, no, he's not eating it. And he is having all manner of processed food. And currently we are having kibble, which is not ideal, but it's the only thing he will eat at times. I had kibble that I use. It's Beco Pets, Wild Boar and Pumpkin. It scores very highly on All About Dog Food. I had it for my treat and train. He is enjoying that. He is eating it. So, as far as I would like him to have a really good diet for it to help, I also have to get the calories in, because we had several days in several, I think, was it 3 days or something? He lost a kilogram, so I have to be really mindful. I've got to get calories in. Otherwise he's not going to have any energy to fight anything. He's not being able to have some of his essential oils in his food because he's just not eating food. So I can't put them in. I'm sometimes I'm just having to scatter some kibble on the floor. And we drove to the beach today, and then I had kibble in my pocket, and I just kept hand feeding him kibble as I'm driving along. Or, I've also got Rocchetto dog food, which is, I think it's a freeze dried raw, and I just kept handing him some little cubes of it. Smaller frequent meals. So nausea or lack of interest in food is common. So smaller, more frequent meals can be more enticing, and you may need to try different food combinations. So this is what I've done, and what I've found really useful as well is I actually put them on a platter. So I've been literally putting like a tablespoon of some raw dog food, which some of it he's eating. He's very flexible, not flexible. He's changing all the time with what he's eating. So some sausage. I think we've had some cooked chicken. We've had the kibble. We've had some ricotta. We've had, what else do we have? Some beef. I got some steak yesterday, and he's on the platter, and then you literally offer him the platter and he just picks out what he wants, and then I'm like, oh, let me get some more of that out the fridge, and I give him that and just offer it to him, and then, you know, as much as he wants. So it's yesterday he actually popped his head in the kitchen for dinner when I had it all prepared for the other dogs, but today we didn't get that. The other thing that's really worth doing is mushrooms with a high beta glucan. So you need mushrooms with over 30% beta glucans. So these have shown to be rich in antioxidants and present anti-cancer properties. There are studies and good evidence. And if you check out my blog, I've actually linked my blog about turkey tail mushrooms there. And the brand I've got in the UK is called Antioxy. And if you're in America, the brand to get is Real Mushrooms. Then digestive enzymes. So digestive enzymes to the food is critical to allow your dog's body to allocate more energy towards healing than digestion. Absolutely crucial. This is something I've not been able to do with Rowan because you have to add them before the food. I have to mix them in. They don't smell of anything, I don't think. But then the food's digesting and he doesn't eat it. And so it's only a small amount he's often having. So it's really, these are some of the struggles, and I just wanted to share about it because it's not always straightforward. But I've also linked the one I recommend and a bit more about it. I've written a blog about it as well. Now, essential oils. There are a variety of essential oils that can support the body in its fight against cancer. So just some ones are things like frankincense, copaiba, and turmeric are really popular choices amongst others. But they can interfere with medications, and you must get expert advice before using them. And not all essential oils are created equally. And if someone's advertising an essential oil for £2, I'm sorry, that is not real. That is not real. And when you get an essential oil, if you want to get the brand that I recommend, get in touch with me, because you need to have the gas chromatography mass spectrometry of the finished art product, not the one that's on the website, because that's just a generic one. It's the one of the finished product, so you know what is in that bottle. But stay clear of brands that are like too cheap, because you can't get a frankincense for that cheap. The frankincense is an expensive oil. So it's really important to understand that. Antioxidant supplements. So supplements rich in antioxidants like curcumin and resveratrol, such as grapeseed extract, pomegranate, or a polyphenol complex are really beneficial. Rowan was on these until about a week ago when he stopped eating. And again, I haven't been able to add them back in. So he is having lots of different things. He's I've got all the dogs around here. I've got Seren under here and Rowan here. So he is having lots of different things and that I'm trying to give him if he'll have them. So support for nausea and appetite. So some specific essential oil blends to help with nausea or vomiting, which obviously Rowan, I think, is experienced. So I've mentioned the odansatron melts, but other things to promote appetite or lack of appetite. So some good options are peppermint, ginger, cardamom, and also wild orange can all be stimulants and also good for the digestion as well. You're all right there, Seren. She's just tickling my foot. So she's keeping it real. So essentials for calmness is very, very good as well, especially if the cancer involves airways, as I've spoken about with Rowan, and agitation. And, copaiba, lavender, Roman chamomile, and valerian are all good options. They're also really nice. There's some blends as well if we're approaching end of life. I've written a blog about end of life as well, which I've linked in the blog. And I think one of the things I really like about scent from an end of life point of view is it helps you anchor to that memory. And I think that's very powerful to be able to have the memory of those oils after your loved one has gone. And they're very comforting for you both as well. And I've delved into that more in the blog. And then adequate sleep. Ensuring your dog gets enough sleep is really crucial for their ability to fight cancer. And if you've got other pets, make sure your dog has a quiet place to relax as well. This is really, really key. Rowan, we went to the secure dog field yesterday, and I thought he was just going to chill in the field, and he didn't. He actually followed me around the field, and I think he's actually quite shattered today. So we went to the beach. I had to carry him up the dunes, and we just sat there, and he didn't come out on the second little bit of the walk we did. But I think maybe he's just deteriorating, or maybe he's just tired from yesterday. I just don't know. But, it's just rolling with it. And then sort of quality attention and enrichment. And your dog may be too weak for walks, but they can still benefit from fresh air and enrichment, which is what I've done the last couple of days. You might want to get a trolley or stroller. This is really a good option. I've been looking at this, and I may do it, but I don't, you've got to take each case individually. It depends what's best for Rowan. So last week I went to a secure field where I could actually park in the field, and I kept the van door open, and he just kept coming in and out. And that was great. And then yesterday, the field that I went to is the one we used to go to a lot, but I can't park in the field. So I sort of carried Rowan out the stroller and put a bed in the field for him so that he could chill out on there. But it was we had a really nice time yesterday, and he did a lot of sniffing and everything. And I think it's really vital for maintaining a good quality of life. Can you hear him snoring? He's just giving out a big snore. I think Rowan doesn't really know that he's ill, but I think he feels tired. So doing things that your dog enjoys will help immensely. And it's really important for you making memories as well. And, you will never regret taking too many photos. But all I would say to you is, for all the photos and the filming and the videos that you do, make sure you're also in the room. Okay. So, if you're doing some photos, do your photos, but actually also do stuff where just set your tripod up, have your camera recording video, because you can pull stills off that and just do what you want to do with your dog. You can pull the stills off, just be in the moment, because it's so easy to miss out on those beautiful memories. So I don't know what Rowan is doing from his cancer point of view. He's snoozing now and snoring. He's snoring gently. It's not too bad from an airway point of view. We've actually had a good day. He's eaten some food. We went and got puppuccinos today at Starbucks. He didn't want his puppuccino, but at least I gave him one. The other dogs all enjoyed it. But it is an hour by hour time. I have sort of I think it's really important as well to score different good days and to set yourself little targets. And if he hasn't perked up by, for me, it's going to be over the weekend, then we had a good day yesterday, and I was really optimistic yesterday. And today it's been a nice day. It's not been as good as yesterday. He's not eaten as much as yesterday. We still had a nice day, but is it a different day today because he's tired, or is it because of the cancer? This I don't know. So you've got to just keep weighing it up and just mark on a calendar if it was a good day, a bad day, and then you can make an informed decision. And I think the aim is to try and go on a good day. But also you want to balance that with maybe not going too soon. It's hard. But I hope that's given you some ideas. It's not the best topic to discuss. I'm really pleased I got through it without crying. But if you would like some help with your dog, or even yourself, and if you're going through it, please reach out to learn about my consultations. I do offer specific cancer consultations, but I always prefer to discuss your situation first with you to determine how best I can help and what the optimal options are. If you've got any questions, feel free to comment or send me a message. And if you're currently navigating this like me, my heart goes out to you. And all we can do is the best for our dogs and keep them comfortable, pain-free, and as happy as possible, and make those precious memories, for they are all we've got at the end of the day. I've gone through quite a lot this year, and it's really hard. And from my point of view as well, you've got to manage your own care. So I keep forgetting to put oils on myself, but fortunately, because I'm diffusing them to keep Rowan calm, they're helping me as well. But I'm taking some great supplements to help, and try and balance that and have some real I've not been able to do my running this week. I've not done my yoga this week because obviously I was dashing off to vets and things like that. So that's sort of the downside. So at least with the oils, I can get benefits passively just through diffusion. So that's made a massive difference. But it's tough. It's really tough. And, you know, navigating the whole holistic side of things can be really overwhelming. So I hope that this has given you a bit more of an idea. There's so many sort of pitfalls along the way, and there's highs. You know, yesterday I was just buzzing, and, you know, it's hard because literally 2.5 weeks ago, he was going on hour-long walks, and he's literally a shadow of his former self. But, you know, it's important to look at a balanced approach if you can, integrating, you know, conventional and natural therapies, and getting the best expert guidance as well. And if you'd like to sort of follow along on our journey, do check out my either my YouTube, TikTok, or Instagram, which is Mazardog, Mazar dog, because I'm sharing a lot about his story on there. And as opposed to my Who Pause Wins page, I'm sort of doing it more on the Mazardog page. If you've got any questions, comment below. I'm linking everything in the show notes. And if you're listening to this, do like it, save it, share it with someone who it might be useful for, and don't forget to hit the follow or the subscribe button. And it's been you know, an honor to share this with you as well. So I'm going to go and chill out with my dogs. I've got 3 snoring ones in here, and I've had to shut the cats out because they just are absolute terrors. So thank you for joining me, and I will see you next week. Take care, stay safe, stay well. Bye.